morning, ma'am. We are coming from Mitra TV. Now we are going to talk about your famous Jananam Reproductive Center.
Jananam is an assisted conception unit, and this was started about 1.5 years ago. It's situated in Karur, and with regards to medical tourism, I'd also like to add that it's very close to Trichy, which is an international airport, and we get patients coming from Malaysia and Sri Lanka through Trichy to Karur for treatment.
When did you start the Jananam Reproductive Center?
I started Jananam about 1.5 years ago. I think it was in June 2008.
Have you got any special training for this field?
Yes, I did actually. I've had quite a lot of special training in infertility. I was in Australia in Westmead Hospital, Sydney, for nearly 1 year undergoing training, and then I lived in England for about 6.5 years, and I trained in England as well in fertility. So this is about my training.
How many cases have you treated so far?
In this a little more than 1 year, we've treated about 51 cases, and we've had a very good pregnancy rate actually. We've had about 19 pregnancies of this, which amounts to a little more than 40, around 40 to 45%, I think, which is actually very good when you look at an IVF ICSI setup.
Can you tell us about the success for the past few years?
As I said, we've only started a little more than 1 year ago. We've had tremendous success, I think. And in each batch, we do batch IVF, and in each batch, we get at least 40 to 45% positives. And we've had a good many women taking home their babies. So I'm very happy with the way things are going and with the success we've currently had.
We came to know that your mother is a famous gynecologist. Is she helping you?
Of course, I think more than anything else, mothers are very important to give their children moral support. And every day, every minute, I depend on my mother for so many things. She's a leading gynecologist. She's here every day, and she has a good grasp of infertility, and she helps me through the day with every task I do and every task I undertake to do.
Have you treated any foreign patients for the IVF treatment?
Yes, we've just actually completed treatment for one patient, and we are waiting results. This lady, this couple, actually, they are from Malaysia, but primarily they are from the Gulf. And we've had many couples who are already registered with us and who will be undertaking treatment. Now, most of these couples, they've come from Malaysia and Colombo, Sri Lanka. And I've also got inquiries from England. We've got some Sri Lankans who live in England who want to come here for treatment. And I'm actually planning to go to Sri Lanka next month to look into this. So I think there's a very good potential for fertility treatment because we're much cheaper than other countries abroad, and the success rate is just as good.
Can you tell us something about the low-cost treatment of IVF for foreign people in your center?
Definitely. I think in America it's very, very expensive. In England it's very expensive, and it's almost thrice the amount we charge here. And so even in Malaysia, I think it's much more expensive than it is in India. The cost involves primarily the drugs, the medications which we use, and the lab charges and our own charges are very small, not much at all. So we definitely can offer low-cost treatment when compared with any other country in the world. And as I was saying, our success rate is just as good.
Can you explain us the method of IVF and IUI for common people?
Of course. I mean, IVF is it's a very big subject. I can summarize it for you as much as possible. I'll just show you a few pictures so that you can understand what we do better. We tend to do IVF and ICSI in this unit. So IVF is where we take the eggs out, we stimulate the ovaries of the woman, we take the eggs out, and we fertilize these eggs with the man's sperm, with the husband's sperm. And ICSI is when we actually inject one sperm into each egg. I can show you a few pictures just to help you understand what we do better. Actually, this is a normal female reproductive system. You can see that every woman has a uterus. This is the opening to the uterus. This is the vagina. This is one tube, and this is another tube, and these are the ovaries. Now, every month, between one period and the other period, round about day 14, one egg is released from the ovary. This is picked up by the tube, and it travels within the tube. Now, after intercourse, sperms are deposited high up in the vagina, and these sperms swim through the uterus and meet the egg within the tube. And that is where fertilization occurs. That's where the baby is actually formed. And this fertilized egg, which is called an embryo, slowly moves again, is wafted through the tube, and comes and gets deposited in the uterus, where it implants and grows to form the baby. Now, women usually, or couples usually, come for IVF because they haven't conceived as a result of a variety of reasons. So one reason is tubal block. So when the tubes are not opened or damaged because of infection, then what we do is we do IVF or ICSI. So what happens is, by giving the woman a variety of injections, first of all, we take control of the ovaries. And then we stimulate the ovaries to produce many, many eggs. And once these eggs reach the right size, we remove these eggs. I'll show you how we pick up the eggs. There's a little film, and you can see that we do it with the help of a transvaginal scan. A transvaginal scan is a scan which is done with a probe which is inserted into the vagina. And we pick these eggs up, take these eggs out, and take them to the laboratory. And there we fertilize them with the husband's sperms. And once they're fertilized, on day 3 or day 4, we transfer these embryos, about 2 or 3 embryos, back into the uterine cavity. So I can show you pictures of what normally happens. So you can see that this is a transvaginal probe, and it has a needle attached to it. And under anesthesia, the transvaginal probe is inserted into the vagina. And you can see the ovaries, which have plenty and plenty of eggs. These ovaries have been stimulated, and you can see each egg is inside a fluid-filled sac called the follicle. And we can see that egg has been aspirated. We've put the needle, we've inserted the needle into the follicle, and we've taken the egg out. So that is what a normal egg looks like once it comes out. So you can see that is the ovary, and the needle is being reinserted into another follicle. The egg is aspirated, and this is how we do an egg pickup. These eggs are quickly taken to the laboratory, where they are fertilized. Now I can show you pictures of ICSI, which is a kind of fertilization where the egg, so you can see this is a picture showing you the eggs. There are 4 eggs here, and sperms are prepared. You can see the sperms inside the test tube. They're being prepared by a special process, and the active sperms are then taken, and you can see the sperms moving on that screen. So these are the sperms which are less mobile because of a chemical which is added, and that's the egg which is fixed by a needle, and that's the sperm which is absorbed, which has been aspirated into a needle and is being injected into an egg. So that is ICSI, which is intracytoplasmic sperm injection. Now once this happens, once the sperm is injected into the egg, we check on the next day to see if an embryo is formed. So this is called the pronuclear stage, when we can actually see the male and female nucleus. Can you see that? Within the egg. This is a fertilized egg, which is called an embryo. And this then begins to divide. And on day 2, you can see that this egg, fertilized egg, has divided. And this is the 2-cell stage. And then it divides further. This is a 4-cell stage. We usually transfer the eggs, or the fertilized eggs, or the embryos, when they are 4 cells or when they are 8 cells. And this is how we transfer the embryo. Embryo transfer does not need anesthesia. It's a very simple procedure, just like doing an internal examination. And you can see the embryo is being picked up in the embryo transfer catheter. And we've introduced the speculum, and this catheter, which is a plastic tube, is gently inserted into the uterine cavity, and the embryos have been placed or transferred, and they are in the uterine cavity. Now, we usually wait for 14 days after embryo transfer to check the pregnancy test, which is a blood test to see if the patient is pregnant or not. We are in the process of expanding, and we're starting another unit in Chennai for the benefit of patients who come from abroad and also who are in Chennai. We try our best to offer the best possible care and provide affordable treatment for patients who find it difficult, who have problems, financial problems. So we hope to improve our system, and we hope to improve our success rate as much as possible. I think we have an excellent team, and we all work towards improving the outcome of IVF and ICSI success rates. I'd like to thank Mitra TV for having given me this opportunity to discuss what I do and to present myself. So thank you once again.